Yes, hello everyone. Welcome, Dr. Malti ma'am. Today we are going to talk. It's welcome everyone to the today's session on what is a fertility preservation by Apollo Fertility. To speak on this topic, I have Dr. Malti Madhuji from Noida Center. She is our in-house consultant. She is a senior IVF consultant with us, and she has done her obs and gynae, done her certification courses in reproduction and infertility. We welcome you, ma'am, today on this session, and we are all eager to know about this topic. So it's
Yeah,
all over to you, ma'am. We look forward to hearing from you. Thank you. It's
thanks
all
for
over to
nice
you.
introduction. Today's topic is what is fertility preservation. Fertility means, as we all know, fertility means the ability to conceive, and fertility preservation is something related to how we ascertain that we can get pregnant in future. So, in simple word, this is the fertility preservation. Fertility preservation can be done for two reasons. One is clinical fertility preservation. That means that what are the medical reason for fertility preservation, and the another one is social egg freezing. Social freezing means when there are no medical reason. I will come to that later on. So, to start with, we will first discuss the medical egg freezing or fertility preservation. As we all know that to get pregnant, we need special cells of the body. In the female partner, these are the oocytes or healthy eggs. In the males, these are the sperms. So, eggs and sperms, healthy eggs and healthy sperm need to meet together by a process that is called fertilization to form the embryo, and then the embryo is implanted in the uterine cavity. In certain conditions, mostly in some cancers, the treatment part, like the treatment part, means the chemotherapy, the radiotherapy, and the special surgery, some sort of special surgeries can affect the oocytes and the sperms. As we all know, that whenever the female is born, she is born with all the eggs. She is going to develop in her entire reproductive lifespan. So once the egg get depleted by any region, then she cannot form her own eggs. The egg reserve is limited for her. Suppose a woman is diagnosed, a young woman is diagnosed with cancer, some sort of breast cancer or other cancer, and then she starts her chemotherapy with hundreds or thousands of eggs. Then the chemotherapy itself may affect her eggs. The eggs may get diminished in number. Her fertility potential may get diminished. So, some of them, after chemotherapy, may stop their periods. And even if they start their period, they might be having problem to get pregnant because of this decreased reserve. Same process can happen with male partners also, the male patients also. Some of them, while receiving treatment for some sort of cancer, chemotherapy, or radiotherapy, their sperms may get affected. The number of sperms may get reduced, or the quality, that is the motility or the morphology of the sperms, can get affected. This is all to which the fertility preservation or oncofertility is related. Oncofertility basically means preserving one's egg or sperms to be used later on after the treatment of cancer is completed. So, oncofertility requires combined effort by the gynecologist, the fertility specialist, and the physician who is treating the cancer. So, combined effort is needed. for fertility preservation. First of all, whenever a young patient is diagnosed with cancer, as we all know that breast cancer these days are getting very common, and in India especially, the women are getting breast cancers. Most of the cases the physicians are getting, it is happening in 1 decade earlier than the Western countries. So when a patient is young and she has not completed her family, then she should be given the option of preserving her fertility. So how we do that? Generally, after diagnosis of a cancer, the patient is discussed about the options for fertility preservation, and she or he is sent to a fertility specialist. The first of all, fertility specialist tries to understand that what is the risk of reduction of fertility is involved in a particular case, uh, whether this is low risk or intermediate risk or high risk. Uh, that depends upon the type of cancer the patient is having, the age, and the sex also to some extent. Like generally speaking, the younger the patient, the less is the risk to the I mean, less is the risk to reduction in her fertility. Generally, those women who are over 35 and have not completed their family, and even if their AMH level is normal, if they are going for certain sort of chemotherapy or radiotherapy, then they have the risk of reduction in fertility later on. So, first, this risk assessment is done, then there is planning, that what sort of fertility preservation they are going to offer her. For young women, and also, I mean, after puberty, in uh, some childhood cancers after puberty, uh, the treatment that is offered is the cryopreservation of oocytes or embryos. And I mean, if the woman is unmarried, then then her oocytes can be cryophased. And if she is married, she is having a partner, then the embryos can be made and the embryos can be cryopreserved. Cryopreservation means freezing of eggs or embryos at sub-zero temperature, and they can be kept like that for say 10 years. So they can be used later on when she has completed her treatment. Uh, for some younger children, even ovarian tissue cryopreservation can be done by a simple surgical procedure. The chunk of the ovaries are taken and then that can be cryopreserved for variable interval, and when needed, then they are used for further fertility. So, for male partners, the process is very simple. For male partners, it is the semen sample that is cryopreserved. How the semen sample is taken? The semen sample can be taken by self masturbation, and usually 3 to 4 vials of semen are cryopreserved, preserved at sub zero temperature. And for some of the males or young boys in which there is problem in taking the sample by masturbation, sometimes by a simple surgery the sperms can be extracted directly from their testes, and then that sample can be cryopreserved for variable time interval. So usually in this manner, and then there is one another option. Whenever for females oocyte or embryo cryopreservation is not possible, then there is another process that is called as ovarian suppression. For ovarian suppression, she needs to take 1 or 2 or even 3 monthly injections to suppress the ovaries. By the effect of those injections, like GnRH injections are usually given, and then the ovaries come into dormant state. The women can stop her periods for that time whenever she is receiving the chemotherapy. And once the ovaries are dormant, then we hope that the damage to the eggs can be minimized. So these are the three processes like oocyte cryopreservation, embryo cryopreservation, and ovarian suppression are offered to the females, and semen cryopreservation is offered to the male partners. Now coming to the social egg freezing. So coming to the social egg freezing, social egg freezing or social fertility preservation is a term that is used when there is no medical indication, but preservation of fertility is important as some of the females, because of there is some issue like issues with their career growth, or they are getting education, they are going for higher education, or because they want more stability in their life, they don't want pregnancy right now, but they are concerned that whether that time interval is going to change their fertility potential later on. So, what happens, as we all know, that in females especially, the fertility is affected by age, especially after 35 years. So, in all those cases, whenever the woman is concerned that delaying pregnancy can interfere with her fertility, she can get basic blood tests done, get her fertility potential checked with help of consultation with a fertility specialist, and then she can go for social egg freezing. The basis for social egg freezing is that to ascertain that some of the eggs are frozen, and then they can be used later on uh, whenever she plans for pregnancy. So the age factor of ovarian aging or the diminishing potential of fertility with time interval will not come into picture. We can avoid ovarian aging this way by fertility preservation. So there are certain questions that can come to your mind whenever you hear about social egg freezing. So I'll try to answer them one by one. That like who needs fertility preservation or oocyte cryopreservation? All the women who are in their 30s and they are concerned that delaying pregnancy can affect their fertility potential later on, they can meet a fertility specialist, and they can meet a fertility specialist and discuss what are the options available. So all the women who are in 30s can discuss these options. And another question that often comes to my mind is that what is this process is all about, how it is done, what you should expect during fertility preservation. Usually you meet the fertility specialist, and he or she can order certain investigations, blood tests, like your basic blood tests and also your AMH value and a baseline scan. And if everything is okay, then the process can be started from second or third day of your coming period. So from second or on the second or third day of your period, you need to visit the fertility center, and then a baseline scan is done to see that what are the number of eggs or follicles in either of the ovaries. Then your fertility specialist decides injection dose for you. Usually 8 to 10 days stimulation injections are required. That means that you can expect 8 or 10 days of continuous injections. So another question comes to your mind, that are the injections painful? So my answer to that question is the pain sensitivity is a very subjective thing. So some some of the patients are very sensitive to pain. So but most of the injections that are used for ovarian stimulation, these are gonadotropin injections, and the uh, most of the injections are given in subcutaneous manner, so they are like insulin injections. Small injections are given, but you have to take that continuously. Then during the process, these injections are given to increase the number and size of eggs in either of the ovaries. We want to select the whole cohort of follicles that are developing in your ovaries, and then after 5 or 6 days of stimulation, one another injection is started. Then in between, you need to visit your fertility center to monitor that how it is growing, how the eggs are growing. So for monitoring process, usually ultrasound examination is done. You can expect 3 to 4 visits during the process of stimulation for ultrasound examination, and then usually the internal ultrasound examination is done. And another thing is that to maybe once or twice the blood test is done to see the level of hormones in your blood. The level of hormones increase with stimulation of your ovaries. Then once the egg sizes, follicle size reaches 17 to 18 millimeters, then your fertility specialist decides that now the cohort is ready, the egg cohort, follicle cohort is ready, and now the trigger shot can be given. So after trigger injection, final injections, after 34 to 36 hours, the oocyte pickup is done. Another process. So for oocyte pickup is a process in which the oocytes are taken out of your ovaries under ultrasonic guidance. So under transvaginal ultrasonic guidance, a thin needle is inserted through your vagina to the ovaries directly, and follicles are sucked out. And this process is not painful because it is done under anesthesia. So another question that comes to patient's mind often, that is the process painful? So the process of oocyte pickup is done under anesthesia, and so it is not painful. And after the procedure, you can expect a little bit of heaviness or a little pain in your abdomen for 2 to 3 days usually, but that is manageable with the help of simple analgesics or paracetamol tablets that are prescribed for 2 3 days. So then, after 2 hours or 3 hours observation, you are sent back to your home. So, another question that comes to patient's mind is when I can resume my duties. You can resume your duties from the next day, or sometimes next day there is a bit heaviness in the lower abdomen. So, after 2 days, you can resume your routine activities. So you have to take rest on the day of oocyte procedure and maybe on the next day. And then from third day, you can resume your duties. So what is done after the oocytes are taken? All the oocytes that are taken out of your ovaries are handed over to the embryologists. After after 1 or 2 hours, the embryologist then denudes the oocytes, and then he decides that how many of the eggs are mature, and then all the mature and healthy looking eggs are cryopreserved in liquid nitrogen for say 10 years, variable period of time, maximum for 10 years. So this is all about the process of oocyte cryopreservation that is done for social oocyte freezing. So, what needs to be done when you plan your pregnancy? Whenever after oocyte freezing, you plan in the future, you plan that now I'm ready to get pregnant. Then what needs to be done? When you are ready to get pregnant, then you need to visit your fertility specialist again, and it's not absolutely needed that you need the whole process of IVF. Then if you if you naturally get pregnant after or within 6 months of your marriage, then you can give consent to discard your frozen eggs. If you are not getting pregnant, then you need to visit your fertility center, meet your fertility specialist. She will do the basic blood tests again, and then prepare the lining of your uterus. Obviously, the male partner is also examined, the basic semen analysis is done. Then the lining of your uterus will be prepared with the help of certain tablets and monitored with the help of ultrasounds. And once the lining is ready, then those eggs are thawed, and then eggs are mixed with your partner's sperm, embryo is made, and then that is transferred inside your uterus. The process of embryo transfer is not painful at all. So that needs to be done when you want to get pregnant. So, how long it takes? So that depends upon the process, whatever we are using for fertility preservation. If somebody needs, as I discussed, GnRH injections, then that hardly takes any time. That uh, for the process. And for those in which we are doing oocyte or embryo freezing, it takes about 2 weeks, starting from the second or third day of your periods. So within 2 weeks, the process is completed. And for semen preservation, again, for semen preservation, hardly any time is needed. The moment you give the sample, uh, that can be cryopreserved for future use. So, so, what are the side effects? Are there any side effects? So, whenever you go for the process of oocyte preservation, it's like complete IVF, it's sort of the IVF process. Only the process of embryo transfer is not done. So, hormones are given to increase the number of eggs in either of the ovaries. Usually, there are minimal side effects that are well tolerated, except for some patients who are having polycystic ovaries. Some of the polycystic ovary patients can have bloating or mild ovarian hyperstimulation syndrome. That happens because polycystic ovarian, all those with polycystic ovarian syndrome have multiple eggs in either of the ovaries, and whenever we give hormone to increase the size of eggs, then all the eggs start growing simultaneously. So sometimes bloating is there, but that is usually managed with some of the medications, and all of these symptoms go off as she gets her first period. So I think from my side, in a nutshell, I have discussed all important points of fertility preservation. Now I am open to the questions. We'll come to the questions one by one. Somebody has asked, what information is important in choosing the method of fertility preservation? So, method of fertility preservation will depend upon the age of patient, her current fertility potential, like her AMH value, and what sort of chemotherapy or radiotherapy she is getting, what time she does have before going for proper cancer treatment. That is discussed with her treating physician also, and then decided that what sort of treatment will be suitable for her. Another question is, what care should be taken by me when we decide for fertility preservation till we actually do it? Actually, the most common problem we are facing, that some many times when a young patient is diagnosed with cancer, then she is not given the option of fertility preservation most of the time, and some of them have not completed their family and they need fertility preservation. So most important is the coordination between the oncologist and the fertility specialist, and the patient should be given information that if you have not completed your family, you can go for this option. So again, the special instruction, if somebody needs, that depends upon the treatment type whatever we are offering. Another question is, if we preserve fertility, what type of complication can be seen in the child which is born? There are no complications. Like, I would like to inform that in general population, whenever you conceive naturally, the chances of malformation in a child is about 2 to 3%. And that is also seen in all those cases in which we have preserved fertility, means we have preserved the oocytes or semen. So there is no difference. So the child is normal and healthy. So another question is, where is the ovum, sperm, or embryos preserved? I think she wants to ask that how we preserve it. As I discussed, that these are all types of fertility preservation: oocyte preservation, or embryo preservation, or sperm preservation. So these are preserved at sub-zero temperature, and with a special technique that is called vitrification. Vitrification is absolutely safe procedure, and they don't damage. I mean, the process of freezing doesn't damage the ovum, sperm, or embryo. So we can expect that with the latest technique, or almost 90% of the eggs can be thawed back. What type of nutrition should we have in this phase? Just balanced diet. I always advise to my patient that take balanced diet and a plenty of proteins. Okay, so I think we are done. Thanks for patient hearing. We will discuss another topic next time. So to conclude, yeah. So to conclude, the fertility preservation is preserving one's oocytes or sperms or embryos to be used later on. Fertility preservation is basically aimed for those patients in which there are risks to risk of their depletion in their fertility with time, uh, especially for those who are diagnosed with cancer and who are really young, have not completed their family, so they can preserve their oocytes, their embryos. And the men, all the men, they can preserve their semen to be used later on. Social egg freezing is also a new concept that is offered whenever the female is in her 30s and she is not ready for pregnancy yet, but she wants to make sure that whenever she plans for pregnancy, healthy eggs are there. So, in all those cases, social egg freezing is done. Okay, thank you.